we treat strain sprains? Yes, we do. We definitely do. Laser is great for an immediate ankle sprain or something like that. It's great for people that have very active hobbies and they want to get right back into it, pickleball, running, anything like that. It is also perfect for the student athlete that needs to get right back into their sport. There's a lot more downtime that is required when you're doing our other therapy called shockwave therapy. We really, really, really want you to rest afterwards. And there is the risk of it making you sore for 2 to 3 days afterwards. So, if we're working with student athletes that are in the middle of their season and the injury is more minor, we tend to gravitate more towards laser to help them get through that and keep playing. If they're at the point where they're injured to the point where they cannot play and they just need to regroup and heal, and or if they're on the break between seasons, that's the perfect time to do shockwave and really get to the root of the problem and fix it, regenerate it, fix it type of a thing. But yes, laser is much better for those initial acute things. Often when we have somebody who is like thrown something out in their words, we will do a combination of laser and shockwave therapy. So we do shockwave first. We try to break up the muscle spasm. There's usually you don't never just throw something out. It's something that has been brewing for a long time. So something that just popped up has probably been in the process for quite a while. So we do shockwave. We figure out where exactly the issue is. And what I mean by that is that calcification doesn't just set itself down overnight. It takes time, it's a process. So if we do shockwave to you and you're having an acute flare up of something, but we find calcifications, and what I mean by find calcifications is that when sound waves or shock waves are going through healthy tissue, you feel nothing. And when we hit an area of calcification, it feels like a very distinct ache. So if we find those areas of distinct ache, we know that you have had some kind of chronic issue going on, even if you didn't know that it was going on prior to this acute flare up. If we don't find any achy spots, it probably is something more acute that's newer that you have not had brewing for a long time. So if we find those spots with the shockwave, it's great. We start working on that right away. And then we use laser to reduce the inflammation, increase circulation to help speed up that healing right away. So we use laser in combination with shockwave right away when it's more of an active flare up. And if somebody comes in with something that has just been chronically nagging them for years, then we would start with just shockwave and not introduce laser until later unless they had a little small flare up in between. So laser is great for those sports injuries, those sprain, strain, acute things, and for an acute flare up of something maybe more chronic to kind of get you through that hump of high pain level, and then moving in towards that just shockwave and adding in laser later for those chronic, more long-standing things. So if you have any questions on what to use for what issue, it's always, tailored to the person and how they respond. So let me know if you have any questions.